Hello, everyone. Welcome to another module of this 8-part series. We are getting closer to the end. Just a reminder, we so far have presented 6 modules. This is the 7th, and we have 1 more to go next month. So thank you for all of you who have been here right through with us. For some of y'all who have jumped in as you can, we appreciate you all. So we're really excited to talk about this module today and kind of see how we can advance and expand our knowledge. So we have our team here today from the UTech lab that houses the Utah School Mental Health Collaborative. We are a technology in training, education, and consultation lab housed within the College of Education at the University of Utah. So first, we want to give a big shout out to our organizations and institutions. Some of this work would not have been possible without this support from all of these funders and collaborators. So we have Cambia Health Solutions, the Huntsman Mental Health Institute, ULEAD through the Utah State Board of Education, and also Utah State University. So the content for today's training was developed by the Mental Health Technology Transfer Center Network. We call MHTTC for short, and the National Center for School Mental Health. So the MHTTC hosted an 8-part series. If you are not aware, they hosted this last year. And for this series, they used the National School Mental Health Best Practices Implementation Guidance modules for states, for districts, and for schools. And when they developed this resource in partnership with the National Center for School Mental Health. And really what it does is it aims to help states, districts, schools really advance their comprehensive school mental health, but also try to get them to engage in planning a process for implementation of that work. So the primary intended audience for this series is district, school teams, and community behavioral health providers who develop and oversee school mental health systems, whether it be class-wide, building-wide, or school-wide, but also anyone really interested in school mental health. This is like a great resource. So I am quickly going to put the link on here. We do know that you do receive a recording. If you did register for this series, you may have received a recording to access this webinar, but if you are interested, please feel free to get in touch with us so that we can give you information on how to access these 2 training manuals. And so here you have, it's pretty much like a guidance module that includes like a trainer and a participant manual. And in this resource, you have 8 sets of slide decks for each and every module that's in the curriculum, but also it talks about kind of like the core features of school mental health. So if you are interested in accessing the curriculum, you can go to the MHTTC website, or else you can reach out to us and we can direct you to the right link. Okay, so here you can see these are the 8 modules that make up the implementation guide. And in this series, we so far have covered the first 6. So foundations of comprehensive school mental health, teaming, needs assessment and resource mapping, screening. Last month we covered tiers 2 and 3. So if you have not had a chance to attend any of these or some of these, you can find all of the recordings to this on the Utah School Mental Health Collaborative website. Again, all of that information will be here towards the end of the slide deck. So today we will be quickly recapping funding and sustainability. And that really talks about essentially how you fund and sustain your school mental health frameworks. And then in the next month, which is our final month, we'll kind of talk about the impact of all of these. So for example, if you've implemented all of these, you'll kind of see how we can assess the impact of all of these modules. Or if you have just implemented some of these, we'll kind of still dive into like, how do you measure the impact? How do you kind of look back and reflect? So we'll talk more about that next month, but today we'll focus on funding and sustainability. So before we do get started, a real quick disclaimer. the options, the opinions actually expressed in this learning session are the views of the presenters and do not reflect the official position of the Department of Health and Human Services or SAMHSA, the MHTTC network, and the National Center for School Mental Health. There has been no official support or endorsement of DHHS, SAMHSA, or opinions described in this document is intended or should be inferred. So with that being said, for a few minutes, I am going to share some highlights from this module as kind of like a refresher, but I do want to remind you that the full module recording is available and can be accessed through the flyer if you have registered that you may have received. So agenda is very short, but there's so much that we can cover in short agendas. So we'll kind of talk about the definition of school mental health funding and sustainability. We'll also go into opportunities to secure and leverage diverse funding sources and talk about how to sustain successful school mental health systems. So with that being said, we're of course going to talk about quality indicators and best practices of funding and sustainability domains. So really quickly, I'm just gonna give you a couple of seconds to read off this slide to really understand definitions of school funding, school mental health funding and sustainability. Okay. So school mental health funding and sustainability refers to the strategies to optimize financial and non-financial assets that are needed to maintain and improve your school mental health system over time. So let's kind of break this definition into two parts and look at it in each individual meaning. So if you take funding, funding is intended to cover the costs of school mental health systems. What's important is this funding. Like when you think about funding, you all like something that we tend to do is think that the funding has to go directly to the school. But that doesn't always have to be the case. Funding could be used to fund partnerships. And those partnerships could be with community providers for services or other partners who provide services to students and families in the school. So for example, if a school has a shortage of mental health service providers, like at their school or their district, then funding can be put towards partnering with the community provider to kind of help supplement the gap. So the funds aren't directly invested in the school, but it's invested in a partnership to support and assist the school. And then we move on to sustainability, and sustainability is always evolving, but really the goal is to make sure that you're kind of like the structure, like the operational structure, the school mental health structure and the capacity are solid, are foundational, are strong, or are sound, that so that your system can continue to grow and continue to adapt to kind of like match the changes that, you know, that happen as a natural part of life. So and that kind of includes changes, changing needs of your students, changing needs of the families that you work with, the community, and the kind of like the other systems you work with. So essentially, in a nutshell, how do you continue to meet the current needs of your students without compromising the capacity to provide those services in the future? And like say maybe next semester or like next academic year. So making sure like it's a stable structure, not for even right now, but also for the future. So these are some best practices when you think about funding and sustainability. And you know, of course, we wanna go by the best practices, and these are always good things to know and also practice by. So we'll go through all of these in detail in the following slides, but I'll give you a minute to read through them. So here we kind of talk about how do you make sure funding happens across the continuum of all of the tiers. We talk about staffing. We talk about how do we maximize what we have. And then we also talk about not only maximize funding, but also maximize expertise. So we'll go through these in the next couple of slides. So the first one is, to what extent did your district or your school use multiple diverse funding and resources to support a full continuum of school mental health services and supports? So having multiple and diverse funding sources to support a full continuum is essential, not only for building, but also kind of sustaining high quality school mental health systems. And some of the best practices include using multiple and diverse funding sources from different levels. So when we talk about levels, we want to think about school level, the local level, district level, the state, and the federal level. And then we want to think about different types of funding. So there are funds that come through grants, there are funds that come through kind of like third-party reimbursements, cost sharing, private foundations, funding block grants. So there's multiple that, if you like really think about the different types of funding. And then you have the systems. So you have education funds, you have physical mental health, public health funds, and you also have substance, for example, you also have substance use allocation. So when you do really think about funding, you want to think about the level, the type, and the system. And then if you put all of those together, there's so many opportunities to apply and gather funding. You also want to ensure that your funding and resources align to support a broad and a full area of services and supports. So you want to make sure you're hitting all of the tiers so that there's adequate funding to support kind of a continuum of care for your students. And this kind of helps strengthen your entire MTSS or your school mental health framework. You want to establish and use a process to develop a process to regularly evaluate and also update kind of a finance plan for supporting school mental health. We'll go through a finance plan towards kind of the end of the presentation because I recognize this may be like an area that's not familiar to some. So we'll kind of talk about some of those towards the end. We also want to establish and use a process to regularly monitor new funding opportunities that kind of come out frequently. Again, the state level, the local level, federal level. So, and then another reason to kind of make sure you do regularly monitor is not only for opportunities, but also like policies that could kind of change, impact school mental health work. So when we talk about regularly funding, regularly monitoring funding opportunities, we want to, of course, explore diverse opportunities. Again, all the way from the school level to the federal level to public and to private. So very briefly, here are some examples. So at the school level, you have principal discretionary dollars, funding from parent-teacher associations or organizations, private donors. At the local level, you have taxes, community businesses, general revenue. At the state level, you have block grant programs that help develop school behavioral health infrastructure. And then you also have children's health insurance programs, which kind of provides health coverage for families with incomes that are kind of too high to qualify for Medicaid, but still who cannot afford kind of the private coverage. And then you also have state health initiatives, and then you have taxes. Then at the federal level, you again have block grants, you have project grants, you have direct payments, legislative earmarks, and then at the private foundation level or private donor level, you have pilot projects, behavioral health prevention, promotion activities. So there's several that you can explore, but it's always nice to have someone who can kind of frequently monitor these opportunities. So developing a finance plan, like I mentioned the last and the slide before, can really help guide a school mental health team's funding and sustainability efforts. So this is a self-assessment and planning guide that was developed by the Research and Training Center for Children's Mental Health. And this offers practical strategies and tools to help, like, for example, your team to develop a comprehensive financing plan. So it walks through developing a comprehensive finance plan and addresses, here you can see 7 important areas to assist kind of the financing system and the sites to develop a plan that works well for your school. So I'll give you a minute to kind of like glance through, but again, like I mentioned, we'll touch finance plans towards the end. So it really kind of goes through the different things that you want to think about when creating a finance plan. All right. So in this and the next slide, I just wanted to pop these 2 examples that I think are very useful when we have all this content and we know we have to create finance plans and we know the steps, but how do you kind of take this and apply? So very briefly, let's go through an example. There's a district example, and then in the next slide, there's a state example. So this one really illustrates how one large urban district was able to leverage funding from education, mental health, and private foundations, and a fee for services to collectively support community partner school mental health. So I'll give you a minute to read through this slide. So you can see how 55% of funds were secured through fee-for-service reimbursement. And then 35% came through taxes, school district funds, so pretty much the mental health and education funds at the district level. And then 10% came from foundations and other grants. So there's no one way to do it. I think the thing is you have to be creative with how you solicit and gather funds. And like I mentioned a couple of slides before, think about the type, level, and the system, and really go for all of it, if the opportunity presents. And then again, you can kind of decide as a school system, how much do you want to gather from the different types of opportunities. So something to think about and talk with your team. And this is state level. So the Pennsylvania state example, this one talks about how they have a long history of success in advancing comprehensive school mental health at the state and at the district level. And they have used braided funding to help support their school mental health services and resources and support. So I'll give you a minute to read through this. So here as well, you can see funding to support the school mental health work, again, came from fee-for-service revenue, mental health and substance use allocations, education training funds, and drug and alcohol funding to support counties in kind of the prevention work. So again, this is also another example of how you can, like the variety of funding that you can gather for your school, and then how you can be creative with those. Okay. So moving on to the next best practice, to what extent did your school or your district leverage funding and resources to attract potential contributors? So how do you maximize your funding and resources? So to adequately support school mental health systems, it's beneficial to try and maximize all of the resources to attract all the potential contributors. And some of the best practices includes establish and use kind of like a formal agreement that specifies contingent funding and non-financial resources. So think about kind of like an MOU where both parties kind of talk about what do the funding partnerships look like, and if there are non-financial resources, what do those exchanges look like? You also want to regularly seek potential partners who may have funding or non-financial resources that can be contributed to support the larger school mental health. And then you also want to not only establish, but also foster relationships with different diverse agencies and organizations in the community with kind of that goal to create more opportunities to leverage funding and resources. So really, if you think about it, a lot of these really depend on rapport and relationships that you have with these partners. And if you don't have, then kind of think about who's in your community and who may have the capacity or the resources to kind of support school mental health work in your community. So some helpful tips for leveraging funding resources are the following. So conduct kind of a comprehensive scan of what are your existing funding opportunities in your school, in your community, that's locally at the state and at the federal level. So with your team, like this is like a task that y'all can do, like explore as much as you can what's available. Establish partnerships with outpatient hospitals and also community behavioral health programs, other agencies and organizations that really have those services and can provide those to students. And that way you can also leverage existing funding resources and infrastructure. So if your school doesn't have a partnership where they can support students in crisis, then like this is something you want to think about, like who in your community can do that. You want to develop a memorandum of understanding that kind of clearly outlines what are the services that were agreed upon. So again, if it's something to do with crisis, then what are those services? If it's like day-to-day therapeutic experiences or services, then what are those? So you still want to like have this documented. And you want to think beyond dollars and consider exchanging services. So for example, professional development and training. So if one group is very skilled at providing training on, say, an evidence-based program or practice, have them do that. So you want to think beyond dollars, because training is also like another valuable asset that you want to provide to your service providers in the school. So again, it's about thinking creatively of how you can benefit from all of these resources that's available. Okay. So the next best practice is, to what extent did your school or your district have strategies in place to retain staff? Now, staff is such an important group for sustainability of your school's mental health framework. And even with funding, there are some schools and districts that experience significant challenges to finding staff to provide their services. So to protect and also support your staff who's invested in this work, you need to kind of, again, think creatively, because you want them to stay in your school. So I'll give you a minute to kind of scan through these little pointers here. So they're pretty straightforward. And if you are a school provider or an admin, you're probably nodding your head yes, yes to all of these. So let's just like go through some of these very briefly. So you want to provide ongoing professional development. It could be in person, it could be virtual. And this professional development doesn't always have to be webinars and things like that. It could be lectures, didactic presentations, peer consultations. So again, however you think is the best way to pass out that information and present that information in effective ways. You want to regularly recognize things that your staff does, their accomplishments, celebrate them. It could be monthly awards, it could be recognition, it could be sharing success stories with others. It can also be personal. It doesn't have to be professional all the time. Think about personal milestones, birth of a child, birthdays. You know, those are things like remembering those things like really make people feel appreciated. So you want to practice open, like have really good communication with your staff. So that is open communication, bidirectional communication, and also providing opportunities for staff to provide feedback, input in situations if it's needed. You can make it anonymous so people feel more free to contribute, but always having good communication. Offer flexible work schedules if that is something that your school has the capacity to welcome, then that's something to consider as well. Provide and evaluate staff wellness activities. Engage staff to provide input on how to optimize staff retention. So talk to staff about if staff retention is a concern. Be open, again, open communication. Talk to your staff about like the real challenge and solicit input, feedback from them about how they could, as a school, kind of address that challenge. Provide supervision and opportunities for peer support. So you can hire mentors, you can hire supervisors, you could have like support groups, buddy programs, anything that feels supportive. Provide opportunities for career advancement, provide incentive-based pay, and also make sure like the salaries that they're getting are fair and there are opportunities for growth within your school. So there are so many ways that you can nurture an environment to make sure staff feel appreciated, they feel supported, and they just want to stay. So this is a district example. I'll give you a minute to read through how this school did some awesome work to retain some of their staff. Very sorry. Let me go back to that example. So this particular school, so it's actually a community partnered school mental health program, but they retain their staff for about 6 years. And how they did that by doing all of these. So integrate a federal loan forgiveness program for staff. That's really helpful. Again, provide opportunities for professional growth, staff recognition, flexed work schedules, part-time options, and then high quality professional development training opportunities. So, you know, we talk about educator and staff burnout. And yes, we want to keep encouraging them, you know, to practice individual self-care. But sometimes we have to think outside the box think creatively about what other factors matter to staff. And speaking of that, organizational self-care is something that I would encourage schools and districts to think about. So as an organization, what can you do to support the wellness and the self-care of your staff? So training and education, support and supervision, employee control and input, making sure like your employees feel like their voice matters, they have some control in decision making, their input is valuable, they're always solicited, open communication, and a pleasant, fun work environment. So this is kind of like a checklist to think about like quality improvement goals. And then on the right hand side, you can kind of see sample items that fall within these different checklist areas. Okay. So moving on to the next best practice, to what extent did your school or your district maximize the expertise and resources of all of the stakeholder groups to support any ongoing professional development? So again, like I mentioned in the last couple of slides, professional development is critical if you want your staff to perform at the highest levels of functioning. And the expertise and resource of all stakeholders should be used. And that's how we can maximize professional development activities. So some things, again, some very brief best practices include you can poll school staff members. So for example, can be teachers, can be nurses, school social workers, school psychs, guidance counselors, behavior specialists, admin, and also like parents, students, families, caregivers, about expertise in mental health related work and content. So that way, you know who has kind of like the knowledge and the information about mental health. Because yeah, we do have school mental health staff, we do have school mental health providers, but there's also other people who may have practice, expertise, and knowledge in those areas. So we want to make sure we gather all of those and we know about those people. We also want to offer professional development activities that use diverse knowledge and skills. So we want to think about family, school, community partners who are engaged in mental health. So some very brief examples, community mental health providers can train teachers to identify mental health concerns. And then school psychs can train community mental health providers on kind of school policies or like the school language. So I think, again, it's like being creative of how you create these trainings and the population or like the audience you want to train. So that way, like there is diverse knowledge, and then all stakeholder groups kind of gather diverse skills. So again, it's something to think about. You can train your school and community employed and mental health providers on the same topics at the same time. So can be about evidence-based programs, supports or services, could be policy and procedures. So like in the previous example of how it's very specifically population driven, you can also at the same time like train a whole group about a certain topic. So it again really depends on how much resources and time and capacity your school or your district has. You can also engage youth and family leaders and also advocates in professional development. You can make them trainers, but then you also can make them learners. Because like the more we know, the better our mental health systems in the schools are going to be. And also you want to use diverse professional development mechanisms. So can be in person, it can be virtual lectures, presentations, mentoring, written resources. So again, kind of like depends on the capacity that your school has. So this is the next quality indicator. I'll give you a minute to read through this slide. It's kind of a two-part question. So the first part, so here we're talking kind of about funding and resources to sustain all the tiers in a school mental health framework. And I think this is important when you think about continuum of care. You want to make sure you have funding to support students who receive services through all of these different tiers. So to what extent did your school or your district have funding and resources to support all these three tiers? And to what extent did your school maximize reimbursement opportunities for eligible services? So maximizing opportunities to be reimbursed for services is definitely a necessary component in making sure your mental health framework is sustainable. So we'll talk more about that. So something to reflect upon. Is your state optimizing Medicaid and private insurance to support school mental health? And if yes, great. If maybe, you're on the right track. And then if no, still, what are some questions that you can think about if you do have goals to optimize Medicaid and private insurance to support school mental health? So I'll give you a couple of seconds to read through these. So when you do think about maximizing Medicaid and private insurance, what are some things that, some initial thoughts that if there's a conversation or discussion that your school is interested in having? Who can bill for school-based services in your state? And out of those services, what services can you bill for? And then other services that are billable. And so you want to kind of think about what can be billed and what cannot be billed. And that'll kind of help guide some of your decisions. What are the services that your state would like to consider adding to the billing services? And then when it comes to reimbursement, what are kind of the challenges of being reimbursed? So in this next slide, kind of talk about the different state examples. So we have Alabama, Arkansas, California, Michigan, South Carolina, and Tennessee. Who received kind of funding through the state to support school mental health. So Alabama, for example, their Department of Education and Mental Health, they developed a cross-system funding to support school mental health work. And then in Arkansas, you have the Department of Social Services, who revised social work job descriptions to provide care coordination in schools. So it doesn't have to be direct work. It can again be something that we work to foster, like the mental health professionals in the schools. And then you have California, where they funded through additional tax dollars. You have Michigan, who revised, so IDEA Medicaid revised to include tier 2, tier 3 counseling. And then you have South Carolina and Tennessee, who again kind of did fund different tiers of school mental health work. Tennessee funded, again, not the direct billable service, but they funded for case managers to be in schools to support tier 2 and tier 3 work. So think about what your school needs. And like I mentioned in the previous slide, just think about, so these are some like initial questions to guide you, but it always does not have to be about billable services. It could be about this like other ways that you can creatively solicit funding, or like put policies in place, or like encourage or support policies that will really help school mental health in different capacities. Okay, so I know initially I did talk about financing, school mental health financing, which is an important process that we need to engage in for sustainable mental health frameworks. So as a part of the National Center for School Mental Health, the National Quality Initiative, there were some virtual training sessions and resources that were developed in collaboration with the American Institute for Research. And what they did was they really helped districts develop a strategic financing and sustainability plan. And that plan is, that process is summarized here. So it's a 5-step process and can really help districts understand and also plan for sustainability of their school mental health. Now, the process is kind of intended to be like circular, and it's supposed to be a continuous process. So we will go through some of these in detail, so that way like you can get a better knowledge of like what these different processes are. And then we'll also give you like, we'll talk about some resources to kind of help you get on with these different steps. So the first one is clarify what you will need. So like what services, what supports do you need, and by when you should have them. Second step is, what are the existing current funds and resources that you have that's available to you right now? Could be at the school level, could be at the district level, but is current and is available to you. Are there any gaps in what you need and what you have right now? And if there are gaps, what are those gaps? And then what is a financing strategy and funding source that you are thinking of? So we spoke about funding sources previously. So think about those and identify what works for your school, and kind of what is your capacity to reach out and solicit those. And then you make and execute a financing action plan. Okay. So the first one is clarify what you will need by when. And this is like a very brief worksheet that helps you kind of orient what you have. What you need and by when. So if you look at the first column, strategies and activities, services and supports that we want to develop and sustain. So this is what the school, for example, needs. So infrastructure investments, services and supports, workforce development, consultation and technical assistance. So various needs. This is an example. So various needs. And then the next column is, over what period will we develop, implement, and sustain? So you want to kind of like have a timeline of when you want to develop, implement, and sustain these. And then moving on to the next row, at what scale and pace will we build and sustain? So you want to think about, how long do you want this for? So here it's like year 1, year 2, year 3. And then for each year, you want to think about what is the scale and like how big do we want to go and how fast do we want to go. Of course, you know, it's nice to start the first year small, so that you can kind of implement, try it out, and then address challenges that you experienced in the second year, which is a nice, kind of like a nice medium. And then you're ready to like really grow in your third year. So again, different ways to think about how you want to implement, how do you want to develop, implement, and sustain. Okay, so the next one is identifying what you have right now. So this is kind of takes us back to, I think, our third webinar, which was about needs assessments and resource mapping. So again, if you look at this worksheet and the previous one, it kind of talks about the same services, activities, and supports. But right now, what resources do you have to support these? So what are the sources of funds? Could be grant funds, again, private donors, state tax money. So like the different sources of funds that different sources that your money comes from. What are those amounts? And of course, we know with different funds, there are certain restrictions. So what are those restrictions, if any? And then when does that funding, when does that money when do you have to spend it by? So pretty much like, how long does the money last for? So this kind of like gives you an idea of when to target new funding opportunities, given how much you have right now. So you wanna resource map your current funds. And then you wanna identify if there are any gaps in your funding systems. And if there are any gaps, what are those gaps? So the gaps are really between what your current needs are and then the resources that you have. So for example, what is the gap between the current spending and projected fiscal needs? So you want to think about, when you think about gaps, you want to think about gaps to services and supports. You want to think about gaps to population served. You want to think about gaps to like the different activities and the gaps to fiscal years. So the funding gap analysis worksheet, this is what you see here. It can be used to really help teams assess current costs of their school mental health systems, the available resources, and then the gaps in funding over kind of multiple years. So you can see this only lasts until 3 years, and that's because in this particular example, they just wanted to look from year 1 through 3. So it's really how you want to do it with your school. So year 1, you think about all of these different strategies and activities, total cost for each, available resource for each. Is there a gap, and what does that look like? So you want to do that for year 2 and year 3. So after you do identify these, sorry, I'm just moving back slides. You want to select a financing strategy. So something that you can do is like really work with your school or your district's business office to, now that you've collected data through steps 1, 2, and 3, you could work with your school's business office or your district's business office to identify what are some feasible financing strategies. Or school mental health providers are well aware of like different funding sources and options. Them as a team can also kind of brainstorm, okay, given now we've identified what we need, we know what resources we have, we know what gaps we have, what are some ideal funding sources that we should start thinking about. And then lastly, create a financing action plan, and then you execute it once you have your funding. So I know that was like a really, really quick overview of this 5-step process for financing and creating sustainable mental health systems. But I thought that would be helpful to include in this presentation today. And that kind of brings us to the end of funding and sustainability module 7 in this 8-part series. If there are any questions, my email is listed here at the top. Feel free to reach out to me. If you did register for this session, you will receive this recording through email. You will also receive a flyer for our last module for this series, which is impact. So do register if you have the time, but if not, we can always send you the recording if you have registered. So again, big shout out to all of our funders and our collaborators. Thank you for attending this session, and I will see you all next month.